Hello, my name is Alani Lakasi, and today I will be speaking about fractures, exercise, and bones. Can adult bones grow due to exercise? Bones stop growing when the growth plate closes, which is around the age of 18. Therefore, in adulthood, our bones no longer grow in length. However, depending on how intense our exercise is, our bones can grow in width. This is called appositional growth and is usually due to weightlifting and resistance training. This is controlled by growth and sex hormones. What effect does weightlifting exercises have on bones? Weight training helps develop stronger bones, especially when we abide by the American Heart Association guidelines, which tell us that we need about 150 minutes of moderate activity per week. When forces are applied to the bone, they are reflected in bumps and ridges that can mark the attachments of tendons and can enlarge with muscles to withstand forces. So if you were to compare the bone of someone's arm of someone who's a runner and a weightlifter, you'd see that the person who lifts weights will have a thicker bone, and that's because of the resistance that the weights provide. If you are inactive, degenerative changes can begin to appear on your bones, and that's especially dangerous to bedridden patients and astronauts because the inactivity and the removal of calcium salts can be detrimental to your health. Ways to minimize these effects can be to reduce the amount of time that you're that's spent being sitting down. So, for example, instead of driving to work, you can opt to walk to work. Bones withstand tension and compression. Stresses or impacts to the side of the shaft can lead to a fracture. A compression fracture happens when the bone has been crushed and is common in people who have osteoporosis and is also common in the spine. With a tension fracture, bone molecules are being pulled apart. So if you see here in this diagram, if you add a stress, the bone molecules here are being pulled in opposite directions, causing a tension fracture. Changes that occur during osteoporosis and their causes. As we age, our bones become weaker, and this is because our collagen and calcium productions decline. We also have a decline of the sex hormones, and the rate of rebuilding bone through osteoblasts slows down. To reduce the rate of bone loss, there are certain exercise recommendations. So you can regularly exercise and participate in resistance trainings or aerobics exercises to improve balance, etc. Someone with osteoporosis is more likely to break a hip because since the bones are weak, falls are more common, and this is also more common in women than in men.